Yes. So we will discuss about the clinical hair care and hygiene protocols. So we know about the anatomical aspect of the hair, where we can see the hair follicles and the base of the hair, sebaceous gland, eccrine glands, right, and hair shaft, which is above the skin layer, and number of the layers that is present in the epidermis, dermis, and where the exactly the follicle is present, that one also we know. So these things we have already discussed in the anatomy and physiology of your first sem, right? So where you can see the erector pili muscle, okay, erector pili muscle, which is helping for the goosebumps of what? The hair follicle, right? The hair shaft above the visible part will be called as hair shaft. Now this sweat glands will produce the sweat, right? If there is any disorders or if there are any psychosocial problems, that time we will do this one. Close the door, man. Yeah. So coming to the what are the diagnostic factor? Don't you have shame? You people are seeing there. Okay, I am doing the class here. You just focus on here. Clear? Clinical baseline. What are the clinical baseline to give the care for what? The patient with the hair disorders. Like that may be not only for the hair disorder. If the patient with the alopecia, you know the alopecia? If the patient with the hair fall, for them we need to give the psychosocial education. Why we need to give? Because their self-esteem and their physical appearance is disorganized. So for that we need to look for the psychosocial health also, and we need to look for any associated disorders for the alopecia. Alopecia may be the secondary, but which is the primary, that one we need to see. Which is the actual cause for the hair disorder? Is that hair disorder due to the drugs, or is that hair disorder due to the some disease condition? That too, is that endocrine system disorder? That we need to check. Especially, sir, which endocrine disorder will cause the problem of hair disorders? That is especially the hypothyroidism. This hypothyroidism will make the patient's hairs to be excessive coarseness and also dryness. So excessive coarseness means that will be like tangled, and somewhere it is thicker and somewhere it is very thin. Okay, that one we can call excessive coarseness and also dryness, and due to that you can't able to comb the hair also, isn't it? That one we can call excessive coarseness and dryness. Are you understanding? So you need to remember, whenever the examiner asks the question of hypothyroidism relating to the secondary hair disorder, that time you should think about what type of signs and symptoms. That one you should say that is excessive coarseness and dryness. Clear? Yes. Coming to the geriatric variations. In elderly people, some elderly people we know that it will become thinner or it may be the diminished also, right? So what we are discussing about the hirsutism, right? So hirsutism means here the excessive growth of the hair will be there. So that may be the female or that may be the male, but in the female it will be hirsutism you will see, okay? Excessive growth will be there, that may be beard, or you can think there is a mustaches, and hairs will be grown excessively. That one we can call hirsutism. Are you understanding? Yes. Coming to the some of the images that we can show. See here, this is the excessive coarseness we can say, right? And this one we can say as excessive growth of the what? Excessive growth of the hairs. Are you understanding? So even that may be the front portion or even that may be the back portion. So this one we can call as back portion. If it is growing like this, we can call it as a localized hypertrichosis, or else we can say Becker's nevus. Understood? Yes. And can you see this one, dandruff? So dandruff is also one of the problem in the hair, where there is a scalp is producing more dead keratinized layers, okay? And can you see this one? This one is ticks. I'm sorry, these are lice. Okay, this is lice, and this one is the nits. What is this? This is the nits. Okay, is that coming there? Yeah, it is nits. This one is nits. Nits means it's a egg of the lice. It is attached to the hair. Okay, and this one, these are the lice. And due to these two, which disorder we can say? Pediculosis. Pediculosis. Okay, for this we need to give the pediculosis, right? So we need to give the pediculocide agent, some of the Lysol, some of the acetic acid or vinegar we can say, okay, or shampooing. So that one we have to do in the which one? In pediculosis, right? And can you see this one? This one we can say in simple word as a bald. Okay, in Kannada we can say boda, right? So bald, for them it is like physical appearance, they are having very low self esteem. So low self esteem, they can't able to talk. So decreased social interactions also may be the one of the signs and symptoms we can see. Okay, so they are not interacting properly to the society. Then we can say they are having this problem because self esteem is reduced, or else we can say decreased body, disturbed body image. Okay, disturbed body image. Okay, so as evidenced by what? As evidenced by the alopecia. Okay, as evidenced related to alopecia. So what we have to do whenever you are doing the nursing diagnosis, please do remember, first you need to write the actual problem. Okay, next you need to write the cause, and next you need to write the signs and symptoms. This is how you need to write the nursing diagnosis. Clear? Okay, related to what? Related to the this one. What did I say? So they are not interacting with the society. Okay, that one we can say signs and symptoms. And what is the cause? The cause is alopecia, right? So related to alopecia. And what is the problem? Actual problem is disturbed body image. Clear? Disturbed body image related to the alopecia. Okay, related to alopecia as evidenced by decreased social interaction. Are you understanding this? So this is how you need to create the nursing diagnosis. Now coming to, this is the alopecia we have discussed. Next one is, this one is ticks. See, this is ticks, don't confuse, this is lice. This is lice and this one is ticks. Sir, what is this? Ticks will suck the blood. Okay, it will suck the blood. For that, what we have to do, we need to apply the oil, or we need to apply any petroleum, so that it will get off from the skin. Clear? Next one. Okay, so can you able to see this one? This one is burrows. Burrows means it will make the alignment, okay, below the epidermis, that too not healthy epidermis, dead epidermis. Okay, if there is a above layer of the epidermis, if it is dead epidermis layer, under that it will starts from the, suppose you think this one is a proximal. Okay, it started from here, and it will make the burrow up to the end, and it line will be like that only. Okay, and there is a exposure of what? Exposure of the line. We can call what we can call this one as burrows. At the end, what it will be there? At the end, there is the scabies. Okay, the scabies. This is what we can say scabies. Okay, I am not getting the name of the scabies agent. I am not getting it. I think it's a scabies only. Okay, so when I get, I will tell you. Clear? So this one we can say scabies. Are you understanding? Especially in the upper extremity and also the lower extremity, it will cause. and for that we need to give the scabicidal treatment, and also we need to treat it with the permethicin, right. This one I said I think in the previous, right, 5% permethicin we need to apply. Clear? Yes. So one by one we will discuss about the dandruff. Sir, for the dandruff what we can do? Dandruff is a dead scalp tissue above the epidermal layer. Madam? Madam, I am in the class, ma'am. Medicinal shampoo. Okay, for the dandruff, it may be the unknown or it may be due to the fungal infection. So for that, what we have to do, we need to give the medical shampooing. Where the things we can see? Both of you stand up. Both of you stand up, I said. Faster. Yeah. Yes. Pediculosis. Next one is pediculosis means lice, as is shown. This one is a pediculosis where there is an intense scratching or there may be bleeding also may occur. Okay. So and nits means that is a egg which is attached to hair follicle that will never get off. Okay. Unless you are giving the vinegar or else acetic acid shampooing. So you need to do the shampooing, that too with some what type of solutions they have prescribed, that one only you should do. So that one we can say pediculosis protocol. If you are shampooing with the prescribed solution to eliminate the lice and its nits, we can call it as pediculosis protocol. I will tell you that in the later, okay, in this class only. Next one is scabies. So it's a itch mite, as I said, it will make the burrows in the upper skin layer, okay, and intense nocturnal itching. Nocturnal means it's a night itching. In the night they will get more itching. Sir, why the night they will get more itching means it is a physiological phenomena where in the night, okay, please listen this one, it is very important. In the night what happens? In the night the body becomes somewhat heat, okay. So it will, body temperature will be increased when you are sleeping. Are you understanding? So due to this physiological effect, that will be active at not night, okay, not night. Due to the physiological effect it will activate. Are you understanding? Whenever there is a heat, body temperature is increased, that time this scabies contagious itch mite will increase their activity. Clear? Are you understanding? Yes. So what we have to do, sir, we need to apply the scabicidal lotion and wash all the linens and whatever the pillow cover, whatever the bed sheet, everything we need to clean it with the boiled water. Are you understanding? So that it can get dye, okay, from it. Are you understanding? So it may be, why we say it is contagious? Because it will transfer from one patient to another patient also. Okay. Suppose they are bed 1, okay, and bed 2 patient also may have the risk to get that scabies if they are touching their towels or if they are using some linen, or if they are using they are touching the directly to the patient, that time there is a chances of getting contagious or contamination. Okay. I hope everyone understood about the scabies. Ticks, as I said, it's a parasite which will makes the blood sucking. A small gray, right, a small gray brown parasite attached to the tissue and it will suck the blood. So what we have to do for that, sir? We need to make the tick to suffocate by applying the oil or a petroleum, as I said previously, right. Last one, alopecia. See this one may be due to the aging or may be due to the genetics. So that what happens, it may be the permanent thinning or permanent balding will be there. So acceptance, they have to accept their what, baldness, and they have to wear the cap. So for that they can't able to accept immediately. We need to educate them to accept gradually, okay, by educating gradually. Are you understanding? So, suppose if the patient with the baldness is very scary and also very depressed in front of the society, and he can't able to talk because they may call them as a boda or as bald, so that they may laugh at him. Okay? So, so that how we can handle for the depression patient, same as it is, we need to handle the patient with the baldness if they are depressed with the bald. Okay? Are you understanding? Yes, I hope everyone understood. See here the nursing diagnosis as per the Nanda also you can do. So, what are the nursing diagnosis? We can see self-care deficit and impaired skin integrity is different, and a skin risk for infection is different. If the skin integrity is lost, that one nursing diagnosis is different, you need to write, and next one risk for infection, you need to write different nursing diagnosis. Are you understanding? Suppose impaired skin integrity due to the insect bite, due to the scalp laceration, that one different, and risk for infection due to insect bite or exposure of the scalp laceration, that type. And here for the risk for infection, you can't able to write any signs and symptoms, you can write only the fever, but how can you evidence that, how can you make it related to for an infection, right? So, it may be the fault of yours if you are not preventing the infection. Okay? So, you can make impaired skin integrity, and you can make the disturbed body image and self-care deficit. Self-care deficit why? Because the patient with immobility or activity intolerance, they can't able to comb their hairs, they can't able to shampoo their hairs. Okay, that time they may get different type of problems. Are you understanding? Psoriasis is also there, right? Yes. Now, coming to the next one, we will get into the what we can say. So, we have to assess the patient first. Clear? Yes. This one we will see in the step by step procedure only, we will see that. Okay? Okay. What are the shampooing procedure? Now, listen carefully, we will discuss about the shampooing. So, this one, can you see this one? I will tell this one in the middle of the procedure only, that is why I am jumping this one. Clear? Are you understanding? Yes. So, shampooing procedure, for that what are the equipments we need? First one, 100% shampoo we need, comb we need, warm water or cold water basin we need. Okay, to protect from the body or to protect the linen, we need waterproof pad, Macintosh, bath blanket, bath towel, and for the waste management we need one bucket, not dustbin, they have given dustbin, bucket we need. Okay, and also washcloth, they have not given another one, that is Kelly's pad. Okay, so how the Kelly's pad will be? Can you able to see this? This is the Kelly's pad. Are you understanding? So, they will apply that balloon, the C shape will be there, no? That balloon will be under the neck, and C shape what the hair will be continuous to downward to drain the water into the bucket. Are you understanding? Can you see this one? This is a bucket is there, and here you can see from the edge of the hairline, up to the end of the hair. Okay, from the scalp edge of the hairline up to the hair end, they are what? They are washing, they are making wetting first. Clear? And later on they will do the shampooing. I will show one by one. First one. So, assessment is normally everyone know that we need to assess the patient, Why we need to assess, sir? Suppose if the patient is a pediculosis, that means pediculosis means lice is there, okay. If the lice is there, you should not shampoo first, or else you should not do the any combing, you should not comb it. Why? What happens, sir? Because if you comb the lice, that will jump off from the, it will jump. Are you understanding? It will jump and it will enters into the cloth of the patient, or it may enters into the cloth of the other patient or may other nurse. Okay. Are you understanding? Assisting nurse or staff nurse, anybody. So that's why protection is needed for the pediculosis treatment. I will tell that. Before that, we will discuss about the shampooing. Clear? This is for the normal routine care or else the prescribed shampooing care we are giving. Clear? So that's why we need to assess, is there any lice is present, that we need to assess. If the lice is present, then we should not do combing. Okay. First we need to do the pediculosis protocols, later on we need to do the shampooing. Clear? Are you understanding? Yes, you will understand about the pediculosis protocol, later on you get to know what I am telling, right. So first we need to assess everything, we need to assess and explain the procedure we are doing the shampooing and gather all the supplies as I said about the equipments. Now coming to the safety and preparations that we need to do for the shampooing. So first you need to wear the gloves and raise the bed and lower the side rails as per previous procedures we have done. Why we need to do? Promote the proper body alignment and mechanics, proper mechanics that nurse should do. Clear? Yes. And brush the hairs. Place the wastewater bucket at the head of the bed. As I said, head of the bed, what you need to do? Head side of the bed, we need to place the bucket. Are you understanding? Yes. So next, so why we have to place the wastewater bucket, sir? To protect the bed environment from the wastewater spillage. Are you understanding? We need to protect the bed. Okay. Now coming to the core washing. Okay, we will come to the core washing. Now we applied what? Being a staff nurse, we applied what? We applied the gloves. Okay, and we need to offer the folded washcloth to cover the eyes. We need to cover the eyes and we need to we need to plug the ear with the cotton balls. Clear? Can you able to see this one? There is a cotton plug, cotton ear plug they have done, and folded washcloth to protect the eye. Right? Whenever they are pouring the water, that time that may enter to the eye also, right. So that in order to protect that, what they are doing, that may be conditioner or that may be water or that may be any solutions. Are you understanding? To protect the eye, we are covering with the cotton cloths. Clear? Yes. And apply the shampoo and lather using the fingertips, and we need to make the patient, okay, from front to back we are doing. Now how you will wash the back of the hair? So you need to lift the head of the patient and you need to what you need to do? You need to lather with the fingertips. Clear? And you need to wash it. Clear? Do you understood? So now everywhere you need to apply, every scalp need to get the shampooing, and afterwards rinse it thoroughly with the warm water and reapply the soap if it is as per the prescribed, and remove the everything dirt which is there. Clear? And you should not, any soap should not be residue in, suppose somewhere here the soap is there, okay, you have cleaned only here, so you should not do like that. Everywhere should be cleaned. Understood? Yes. Now coming to the next one, drying and restoration. We need to wrap head around the towel and dry the face. Clear? And position the patient comfortably. Okay, and clean the equipment and restore the unit, lower the bed and raise the safety rails, as I said. Clear? Okay. So coming to the evaluation and documentation, we need to evaluate whether everywhere we cleaned or everywhere we have patted correctly, everywhere we have lathered correctly, we need to assess. Clear? And what about the patient response from it? That one also we need to collect. Document the patient's response and tolerance from this shampooing. Are you tolerated or not? So that one also we need to assess. So these things we have discussed about the shampooing. I hope everyone understood about the shampooing. Now we will come to the pediculosis. Clear? Pediculosis. Now in the pediculosis treatment, what is the difference, sir? Shampooing we are doing only for the hygiene. Okay, and what about the pediculosis? We are treating, we are not only cleaning, we are treating here. And what you are treating, sir? We are treating the eradication of the parasites, especially the lice and their nits. Okay, so lice and their nits. Nits means that is egg, right? Okay, we are also gloving here, and here strict isolation, not only the gloves. In the pediculosis protocol, we are not only wearing the gloves as like shampooing. In the shampooing, we are only wearing the gloves. We are not wearing any PPE kits. But here we need to wear everything, gown, and what about this one? The gown should not be like cloth. It should be like what we can say. It should be plastic material. Okay. Why we have to wear the plastic gown, sir? Because the parasite should not jump from the patient's hair to the cloth. That may hide in the cloth also. Are you understanding? So that's why we need to give this type of precautions. Strict isolation we need to do, and we need to close the door. We need to give the privacy for the patient. What is this privacy? Why this privacy is needed? We are only exposing the hair. Why we need privacy? Privacy is not only for the body parts. Privacy is also needed for the this one to eliminate the infection transmission from one, eliminate the infestation, not infection, I am sorry, infestation of the parasite from one person to another person. So don't use the infection, here infestation, that is staying in the hair follicle, right? So that one we can say staying on the scalp, sorry, staying on the scalp, that one we can say infestation. I hope everyone understood. We can use some shampooing that is as a like commercial, clinical plus whatever clinic plus whatever the shampoo we will get, that one we can use in the shampooing. But in the pediculosis treatment, exact the medical prescribed solution only we need to use. Lysol we are using, why we are using? Because to make the lice to escape from the hair follicle. To escape, we are using the Lysol. Sir, if it is escaping, then it can go along the hairline to the forehead also, and it may enter to the eyebrow also. Yes, chances are there. Then what we have to do, sir? We need to apply the Vaseline. We need to apply the Vaseline at the hairline. Thicker we need to apply. Sir, why we need to apply? Because it is a barrier. It is a barrier. So first you need to apply, and later on you need to apply the Lysol. When you apply the Lysol, it wants to escape from the hair to the hairline and towards the forehead, but it can't able to escape because this is a barrier. Vaseline is a barrier now. Are you understanding? Yes. Now, why are you making it escape? You can kill, no, that one you can kill it by kerosene or a coconut oil. Okay, kerosene or coconut oil, mix it and you need to apply. Clear? And if it is only the lice is dying, kerosene with the kerosene and oil mixture, then their egg also should die, means we need to apply 6% of acetic acid. It should not be done at the primary, it will be done after 1 week, or else as a secondary treatment we have to do. The primary treatment is kerosene and coconut oil mix. What is the secondary treatment? Acetic acid. Are you understanding? Everyone understood? Okay. Immediate wash will be there, but here immediately we are not washing. What we are doing? We can keep it for 3 minutes, or else we can keep it for overnight. Clear? Depending upon the agent what we are applying, that one depends. So what are the clinical agents that clinical dangers that can pediculi lice can do? Severe itching it will do, and it may make the discomfort for the patient, and it may suck the blood, unlike to the this one ticks. This one is also have a power to suck the blood. Acts as a vectors. It acts as a vector as a typhoid fever. Highly contagious. It's a highly contagious, means it can easily transfer from one patient to another patient. That's why we need to give the protocol for this patient, these type of the patients, right? Yeah. Now coming to the what are the equipments is needed for the pediculosis: waterproof sheet, cap, kidney basin, ounce glass, spoon, 7% Lysol, Vaseline, pediculocide medications like kerosene and coconut oil mixture. Understood? Yeah, these are the what? These are the equipments. Now we will see the procedure. Same like we need to assess the pediculosis, any clinical need, or we need to explain that, and we need to gather all the supplies as I said. Now these are the same thing as we have done previously. Now get into the second one, strict containment. We need to make the barrier. If there is any you think lice is a terrorist which is there in the forest. Forest is your hair, you think, okay? Lice is present in the forest. Now we need to kill in the forest itself, okay? We should not make that enter into Indian border. What we have to do? What we have to do? We need to apply the barrier here. Which is the barrier? That is Vaseline is the barrier. We applied the barrier, not thinner. We need to apply thicker. Okay, we need to apply the thicker barrier so that when we are shooting everything, shooting every terrorist, if we are shooting every terrorist here, it should not escape from the forest to enter the Indian border. For that, we need to apply what? We need to apply thicker Vaseline. I hope everyone understood. Yes. Prepare the patient with that one, same thing. Thick layer of the Vaseline should be done. Before that, we need to protect the patient's bed and wear the protective gown. Protective gown also we need to apply. Clear? For the patient also we need to provide. So why we need to apply the thick layer of the Vaseline? To impassable physical barrier so lice will not fall onto the patient's face as they attempt to flee the chemical treatment. So as chemical treatment, which is the chemical treatment you are giving? Kerosene and coconut. You are going to give Lysol or you are going to give the kerosene and coconut oil mixture. That time it may flee. It may flee from the where? Hair, or else you can say from the forest to the face, right? So that what we have to do, we need to apply this barrier. Understood? To prevent that flee from the chemical treatment. Which is the chemical treatment? Chemical treatment is not a Vaseline. Vaseline is not a chemical treatment. Are you understanding? Chemical treatment is Lysol or that kerosene and coconut mix. Okay. Do not comb. Here it is there. Do not comb hair prior to the treatment. You are giving the treatment here means you should not comb prior to apply Vaseline. First you need to apply the Vaseline, later on you need to do the shampooing, or else you need to apply the treatment. But you should not comb. You should not do combing. Why should not we do? Because it may jump or it may attach to the brush also, that brush or else comb. On that also it may attach, okay, and it may jump to other parts of the body, right? Yes. When? If it is badly infested. I hope everyone understood. Yes. So what are the chemical application? Now we have applied the Vaseline. What are the chemical application we can do? So you need to separate the like smaller section, we need to separate what? The hairs. And next we need to apply the pediculocide medicine so that it can apply, and we have to apply everywhere. If you are not applying here, what happens? Everything will come and stay here, okay, at one side. Where you have not applied, there all the lice will come and stay there. That's why we need to apply everywhere up to the border of Vaseline you have applied, okay. Clear? Yes. And roll up the hair. Why should not we do like this? Why we should not leave the hair end as it is? Because it may travel from the scalp to other part of the body also. So that's why we need to head end of the hair we need to tie to the upper aspect, okay. So roll up the hair to the top of the head and cover tightly with a cap or a sling. Which sling? triangular sling where we can tie it, and another end we can insert that. Clear? Are you understanding? So triangular sling will be like this. So you need to tie it both, this one, this end you need to tie. Later on the upper end will be inserted towards it, inside it. Okay? Are you understanding? That is a triangular sling. I hope everyone understood about the this one, phase 3, that is chemical application. This is very important. Which one is very important step? This one is very important step that you should remember. Understood? Yes. Get into the environmental neutralization. Now you need to remove all the contaminated equipments that you have been used for the procedure. Okay, and you need to wash thoroughly, utilize the standard clinical hand washing protocol you need to do, okay, in order to prevent the cross infestation. Now we need to do the 1 week after, we need to assess again. Why we need to assess again? Okay sir, we have killed the terrorist called what? Lice. We have killed the lice. What about their eggs? When we need to assess, their eggs will be very minute, that may become big, in after week. Okay, after week that may become big. So that we need to wait for 1 week and reassess the hair and scalp for the nits. For the nits we need to assess again, reassess again. Clear? If it is present, sir, if the nits is present, can we apply the kerosene and coconut, or else can we apply the same thing, Lysol? Answer is no. What we should apply then? We should apply the acetic acid, or else we can say that is 6% acetic acid, or else we can say that is vinegar. Are you understanding? Everyone understood? Okay. So the last final thing is, what are the things we understood from this hair care? So we understood one thing. We are not only treating the patient hair, we are also protecting the environment from that hair infested lice. Clear? We understood that one. And another thing what we understood not only before touching the patient or before physical mechanical actions, mechanical implementations, we are considering the dignity and comfort also. We are not making the patient to be discomfort and later on we are doing the treatment. No, we are not doing that. First we are explaining the procedure, and afterwards taking the informed consent, we are going for the what? We are ensuring the patient's comfort, and later on we are doing the patient care. So that's why we are preserving the dignity of the patient also and comfortness of the patient also, even though that is physical mechanical implementation. Next, meticulous continuity of care from the exact hairline up to the end hair end, we have done everything to be clean, and we have make sure everything to be clean. So that one we have understood here. Okay, every area we have completed, right? Now coming to the MCQ, please tell me the answer for this. In the treatment of pediculosis, why is Vaseline applied to the skin? Option A, to increase the absorption of the pediculocide medicine. Option B, to protect the skin from the corrosive effect of 7% Lysol. Option C, to suffocate the nits that have migrated to the forehead. Option D, to prevent the lice from falling onto the patient's face during treatment. So what is the question they are asking? Why we are using the Vaseline? They are asking that question. So you need to tell the answer. It will make the absorption more. Is that the answer? Option B, what it is saying, because of it will protect the corrosive effect of the Lysol. Is that the answer? Option C, it is saying that this Vaseline will suffocate the lice. Okay, or as option D, it is saying that it will prevent the lice from falling onto the patient's face. C. Which one is the answer? C. You people are saying C, na? D or C? Now coming to the increased absorption is a wrong answer. To protect the skin from the corrosive effect, so Vaseline will not make any prevention from the corrosive effect. And here coming to the C, suffocating the nits. Which one will make the suffocating the nits? It is not by the kerosene and coconut also. It is not by kerosene, coconut also. Then which one have the ability to suffocate the nits? That is acetic acid, or else we can say that is vinegar. Then what is the answer? Vaseline will prevent the lice from escaping from the hairline to face. Then option D is the right answer. Okay, option D is the right answer. So next one will be the homework for you people that you should answer in the comment box. Thank you for watching the video.